Very good evening to everyone, and I'm Dr. Anchal Makhija from Mohan Foundation, an NGO which is promoting organ donation from past 26 years. I welcome you all for today's online webinar on post-transplant skincare. So today we have a great delight to have Dr. Sandhya Pradhan with us. She is a dermatologist practicing since 22 years. We welcome you, Dr. Sandhya Pradhan, to our platform. And uh, over to you.
Thank you. Thank you, Achal. Should I start now?
Yes, ma'am.
I'm Dr. Sandhya Pradhan. Today we'll be talking about skincare post-transplant and the various dermatological problems. Good evening, everyone. I know you have gone through a huge ordeal to receive a special privileged organ, and you require lifelong immunosuppressive drugs to prevent its rejection. Now, these drugs exert effects on the recipient skin, which include skin infections, skin cancers, and drug-induced skin disorders. Skin infections, these are most common post-transplant during the early period due to the high dosage of the immunosuppressive drugs. These can be viral, fungal, or bacterial, and rarely septic. Now we come to viral infections. What's are most common? These occur on sun-exposed areas like face and hands, and they are seen as dirty-looking, harmless growths. Herpes zoster infection can also occur as group blisters in a certain on one side of the body, and it is associated with lot of pain either before the rash or along with the rash, or even it can exist till all the blisters have been healed. Herpes simplex infection occur as ulcers in mouth or on genitals. Nowadays, warts and herpes zoster infection can be prevented by vaccination. Fungal infections like ringworm or candidal yeast infection or pityriasis versicolor are also common. Ringworm infection are seen as circular red eruptions with a lot of itching, and candidal mouth infection can also occur. Pityriasis versicolor are seen as harmless white colored or dark colored patches on skin, and this can be cosmetically disfiguring and very rarely itchy. Bacterial infections like abscess, cellulitis, or rarely cutaneous tuberculosis can occur. Scabies, chronic rash associated with itching, especially, which is very rare but still has to be kept in mind. Sun exposure effects. Skin cancers can occur in the late period, especially in the elderly. This is due to long-time immunosuppression, especially in sun-exposed areas. Hence, sun protective measures should always be taken. Now we come to drug-induced skin conditions. Due to allergy, acute onset of rashes or hives due to allergic reaction to any drug can occur. And other skin conditions can occur due to individual drugs, since all the drugs are initially in very high dosage. And as the dosage is reduced for maintenance, these conditions may lessen or may even disappear. If they are less, they can be always treated by a dermatologist. But if they still persist and are really worrisome, then you can consult with your physician to change the drug, but never stop any drug because of any of the cutaneous side effects. Now, due to steroids, there is always weight gain with moon face, buffalo hump, and truncal obesity. The next is facial hair, delayed wound healing, easy bruising, thinning of skin, making it fragile and sensitive, and stretch marks. Acne occurs in the first year post-transplant, especially in younger patients, due to cyclosporine, acne, excess facial and even body hair, and swollen painful cuts. due to tacrolimus, increased sensitivity to sun, dry skin, or hair loss. Due to azathioprine, increased sensitivity of skin to sun and hair. Due to mycophenolate mofetil, oral ulcers, acne, swelling of legs and feet, and eczema. Due to sirolimus or everolimus, oral ulcers, acne, swelling of legs and feet, peeling of skin of palms and soles, leg ulcers, and impaired wound healing. Now, these are the most common side effects which you might have uh, experienced, like moon faces with excess facial hair, then large multiple stretch marks, body acne, excess body hair, swollen gums, and oral ulceration. Now, all of you must be interested in knowing basic care routine and basic hair care routine. Um, for individualized experience, you better consult your dermatologist. But I can give some tips regarding basic routine. Now, skincare routine: use of sunscreen during daytime with SPF of at least 30. Use of moisturizers for dry skin. Now, these should be non-comedogenic and preferably paraben-free. And self-examination for any unusual fast-growing skin growths. Now we come to hair care routine. Use of sulfate-free shampoos. Uh, the keywords will be SLS or SLES free. Then anti-dandruff shampoo, restricted to scalp usage. Use of silicone-free conditioners. Use of ammonia-free, PPD-free hair colors. Then avoid doing any chemical treatments. Use of natural hair oils like coconut oil, almond oil, or Moroccan argan oil, olive oil for dry scalp and hair. Thank you. Now,
Thank you so much, doctor. It was very well explained, particularly the side effects of these drugs. So we have already received few questions in advance, and I want to ask those questions. First question is like how to, like you have shared that we due to steroids we face problems like hair fall. So how to combat hair fall? Hair fall is another option, is another example, but also there is something like the hair growth is very reduced. So what can be done to increase or improve our hair growth?
okay. See, in the initial period, I told you, the dosage, these are all usually side effects are all dose dependent. So once you're settled on maintenance dose and still you're facing any problems, we can correct with different modalities. Like for hair, first of all, we always see, is it related to the drug or is it because of any other reason like nutritional deficiencies or any other hormonal problems like thyroid problem, PCOS? So we can investigate the patient likewise. For hormonal problems, we can do the hormonal profiles like to rule out PCOS or thyroid. And for nutritional deficiency, we can always ask B12 and vitamin D. Okay. Uh, we see any insufficiency or deficiency, we try to correct with supplements. Now, then still there is a hair fall. Then there are different hair growth serums which have peptides. Now everybody thinks that allopathy is something chemical and prepared from labs and all that, but it is not so. Now all these hair growth peptide growth serums have ingredients which are extracts from something from the nature, and they are purified and studied and made available to the patients for so that they can use in an acceptable manner. Okay, we have everything from nature only. Now, Ayurveda is also very strong in India, and there are so many Ayurvedic hair oils, but all of them have a base of strong, odorful oil. So even if you apply this to rinse off all this, you end up using lot of water and shampoo, and this causes a lot of dryness of hair. So once in a while, like once a week or twice a week, Ayurvedic oil should be good, but then it's not sufficient. So we have beautiful hair growth serums which are now available. Still, if the hair fall persists, then we can use medications like minoxidil. Now, oral preparations. So we can rest. There are a lot of preparations to be applied, so we can restrict to that also. Still, if any problem is there, then we can consider oral medication
So hair serums can be applied daily, or it should be alternate days?
daily. Daily.
Okay, okay. So after hair serum, we have to wash our hair, or is it okay to leave it like that?
They are stay-on solutions, so they are just
Okay,
left.
okay. So we have got another question on the chat box which says that can I use moisture with oily skin because skin keeps on altering due to weather?
Okay. Now, see, moisturization part is basically it's the selection of the moisturizer. So there are different formulations available. There are lotion, creamy lotions, then creams, okay, and even like greasy creams. So there are different ingredients available again. So ceramide-based ingredients have better moisturizing capacity because they hydrate and they repair the skin barrier if it is disturbed. So the ceramide based are on a little bit costlier side, but they are good one to be used. Because all the over-the-counter moisturizers, they are uh, they are again of different formulations and different ingredients, and they have a lot of fragrance. Usually, what a dermatologist prescribes will be minimal. They will have very minimal fragrance. So what we try to use is fragrance free, paraben free moisturizers and customized to the skin of the patient. We select accordingly, and according to the weather it keeps changing. So there will be you can use lotions during summers and heavy creams during winters, and again the frequency can be varied, so once a day, twice a day, so that can be also customized.
Right. So another question is like she's sharing that she has warts on her hand, no treatment given by any dermatologist for that. What do you suggest for that?
No treatment will not occur because there are certain solutions, there are certain creams now available, like salicylic acid based solutions, urea based creams, which take a long time, but they can work. And we always give zinc supplements to increase the immunity. Okay. And there are modalities for excision, like cryosurgery, electrical surgery, laser surgery. So there are different modalities. There is now latest what we call immunotherapy. Now, maybe that therapy we might not use in these patients because they are you're on immunosuppressive drugs, but definitely applications or surgical modalities are available.
So I was asking, is there something also related to painful warts or painless warts? The treatment will definitely vary, right?
See, usually warts are painless.
Okay.
The palm I mean, the warts on the palms and the soles can be painful. So
Hmm.
it is not
Right.
whether they are painless or painful. The treatment isn't vary. Of course, the pain occurs in the later period. So that means the
Okay.
patient has taken a long period to reach the doctor. Usually,
Right.
these are slow growing growth.
So we have another question, and she's asking that some of the immunosuppressant agents they cause hair thinning. Also, there is facial hair growth, and also skin becomes prone to acne. Like steroids are responsible for that, and other medicines as well. So, what is the specific treatment they are asking, or any solution?
See, for acne, we can give you certain creams like antibiotic creams and exfoliants like retinoids. There are different combinations available. So some in morning usage, so for some in morning, for some at night, or there are combination creams. And still, if it's not working, then oral medication like antibiotics or isotretinoin can be given. And even now, chemical peels or lasers, which are all, I mean, just surgical modalities, but these are small surgical procedures, harmless, and nothing oral intake is given there. Still, if they're worse, then always oral medications are there.
I was
Uh,
about to ask this, how safe laser treatment for skin is for post-transplant people. Is it okay? Is it advisable?
Laser treatment, if very small lesions are there, then maybe, but that will totally depend on the skin type and the decision taken that time by the dermatologist. So sometimes we are just scared of everything, but it is best that only after evaluating the skin type, how much duration has occurred since taking the immunosuppressive drugs. So that way the dermatologist can decide. It will not be, of course, for everyone.
So for facial growth also, it will be decided by doctor as per the growth of the hair.
Yeah. See, facial growth usually it can even disappear once the dosage has reduced. But still, if it persists, then laser is the only option, which can be
Is it
decided
safe?
by
Is it
the.
safe and advisable, right?
It is safe, but then maybe the patient will have to take a lot of care also, like sunscreen. If it is on sun exposed areas, then uh, face being sun exposed, then a lot of usage of sunscreen, a good sunscreen, SPF 30 or even 50 plus SPF. So even that requires. It is not just that the patient comes, does the sitting and goes away, and at home he does nothing. So it is always in skin there is no solo treatment, so it is always combination and lot of care even after the treatment, and whether the patient can follow all this regime, then only the treatment will be advised.
Right. So we have got another question, eczema. So can eczema be cured?
It's a good question. See, eczema, actually the basic cause is dry skin, meaning the skin has deficient natural moisturizing factors. Now, this can be genetic or even acquired. So it can be right from birth or it can be acquired. Um, Now, basic thing is to use a moisturizer regularly, 365 days. It is not only during winters. It is throughout the year. Still, other triggers are also can be there. Like stress is also one of the trigger for eczema. So, in spite of using moisturizer, patient can get eczema. But if you're using moisturizer, the frequency of getting the eczemas will be less, and intensity also, severity of the eczemas will also be less. And still, if they occur, then medications are always there. If they are very less, then just we stick to oral, applications. Like there are steroids, or there can be even tacrolimus creams, ointments, lotions, or there are newer medications also now available for eczemas. So basic thing is if you take skincare routinely, like application of a good moisturizer, then then you can keep them under control. No one of us can guarantee that they will disappear. Many of the skin conditions are reoccurring. We can just keep a control over them. We yet don't know whether we can cure them permanently, because there are various triggers, and environment is also one big trigger. So because skin being an external organ, it is exposed to the environment, so environment effects are also very important. And aging, so there are different factors, triggering factors. So all can, if they are not assessed, aging is not in our hand, environment is not in our hand. So the basic skincare routine, like use of moisturizer, can be definitely done by the patient.
Right. So role of moisturizer, we all are understanding it is really important, and sunscreen, of course. So
and
we have got
sunscreen.
another question that is there any treatment to cover bald spots, or there's some treatment like PRP treatment? Is it safe for transplant recipients?
PRP, safe regarding safety, if the patient is really stable and uh, not on it's not you can't say 100% safe for PRP.
Okay.
But if really nothing is working and everything is stable, the patient is not having any infections, is not prone for any infections in the past few years, or then the decision might be taken by the dermatologist. But we can't, no one will guarantee that it is 100% safe.
And how about any treatment to cover the bald spots?
Bald, like totally bald spots, then because total bald spot meaning the hair follicle is not there, so that requires only
Hmm.
transplant.
Okay.
So again, transplant, the transplant surgeon will decide, but it's difficult because lot of immunosuppressive drugs are also there.
Hmm.
So it the safest options will be application. So hair growth peptide serums and minoxidil.
Right.
So these are quite safe. So these can be used.
Okay. So, yet another question is regarding a facial wax. Is it good or bad for sensitive skin? And shall we use face serums on a daily basis, or either sunscreen is sufficient for that?
See, waxing, if your skin has become very sensitive and thinned out, then better to avoid waxing. And then appellation creams can be tried. And what was the next question? Face serum.
Serums, face
Yeah, face
serums.
serums. Now there are multiple face serums available. Like usually these have vitamin C and some anti-aging products. Now depending on the skin type, if we can prescribe certain face serums, and they can be used daily on a daily basis. But the skin has to be evaluated. Just don't go and
Hmm.
buy over-the-counter products, because
Right,
you
right.
might land up in bad acne also because of these products. All these products finally have some or the other oily base. So if your
Yes.
skin is really oily and prone for acne, then you might land up in exacerbation of the acne. So the products, whatever have to be, the skin has to be evaluated, and then the patients can use them on a daily basis.
And I think a visit to dermatologist is must for all of us.
Yeah, correct.
In addition to that, there is some people are referring to flax seeds and some supplements. So how would you suggest, are these supplements for hair growth are good? Shall be taken?
Yeah, they can be taken. Otherwise, there are nowadays all pharma companies have prepared certain vitamins and minerals combinations. So supplements are available. So whenever our hair patients come, we give them those supplements rather than just giving a B complex, because B complex is for overall health, but hair requires like they require copper, selenium, iron is very important. Okay, then copper, selenium, these micronutrients, and amino acids, so cysteine, and so all the cysteine-based amino acids. So these preparations are there in hair nutritional supplements.
Nice, which is a new information for all of us. And there is one more question, that how safe is hair color for the skin or for our hair? Is it safe to use it post transplant?
The safest natural hair color will be indigo and pure henna. Okay, that is the
Hmm.
safest. Now,
Okay.
next to that, that's why I had mentioned in my slide that use of BPD-free
Hmm.
hair colors. So these hair colors will be semi-permanent. That is, they will last only up to 28 washes. Now,
Okay.
PPD, like paraphenylene diamine, this is a very harsh chemical and it is more prone for allergic reactions. Okay. And even causing disturbing the quality of hair and causing hair fall. But alternative to that is toluene. So toluene diaminosulfate, which is also a chemical, but it is less harsh than PPD. And only PPD and toluene can give a great gray coverage. The rest of the colors, like dyes or colors, which are natural, like indigo, henna, they will not give you dark coverage. Okay, because and they will get washed. Indigo will get washed out faster. Henna will never give you a dark coverage. It is naturally orangish brown. So we don't want orangish brown color on our hair. So so that's why indigo is mixed, but indigo washes out faster. Okay. So PPD free hair colors will be the safer option. There are multiple brands available. Um, and being a little less harsh on the hair, they are on costlier side. Like there is a brand called Cutie Color, so it is quite commonly used hair color. And so because we will not advise not using, if anything happens, any allergic reaction occurs, you can always approach a dermatologist. But take care that you always do a patch testing before application of the hair color. That is 48 hours before, 2 days before the hair coloring, you do the patch testing, and this has to be done every time, because even if you are not allergic the last time, you might get allergic this time. So every before hair color session, you have to get patch tested. So that on that side also you will remain safer and not undergo any severe allergic reactions to the hair dye.
Right, right, right. So another question is, warts are getting multiplied gradually. So and also on the forearm and back of hand and forearm. So what should be done in that case?
See, there are certain drugs now available. There is a drug which is oral medication, which is used for multiple warts. So, wart is basically overgrowth of the tissue. So, this drug tries to control the tissue, and along with that, we do the surgical modalities. So, the growth is also kept under control. And but again, this drug has lipid abnormalities, okay, like the fats, the cholesterol triglyceride can increase. And if patients are on cyclosporine, then they also have tendency for increase in triglycerides or cholesterol. So what combination of drugs patient is on, whether he's on cyclosporine or other immunosuppressant drug, that way um, the decision can be taken by the dermatologist. What I mentioned, immunotherapy, like we inject certain certain medication, like even if we inject MMR vaccine in the ward, immune reaction is produced, which clears all the wards. But because these patients are on immunosuppressive drugs, maybe this is not the treatment of choice in these cases.
Right, right, right. So also there is this relatable question that are skin tags similar to that of warts or they are different?
No, they are different. Skin tags are just epidermal growths occurring because of aging or genetics, sudden growth in weight gain, like sudden
Hmm.
weight gain, maybe
Right.
because of steroids or
Hmm.
commonly seen after pregnancy. So these are just harmless growths and they are mainly of cosmetic concern.
Right, right, right. Also, something like you shared in your presentation about gum hyperplasia, where our gums are getting swollen. So, can you tell a little about how to deal with such cases, like for certain that situation?
Yeah. See, if the swollen gums are there, then maybe that brushing and everything will be difficult. Then the dental hygiene has to be really, patient has to take extra effort for dental hygiene. Um, and if really they're causing infection or gum infection is there, then it can be treated by antibiotics. But basically, they reduce after the cyclosporin dosage has been reduced.
Yes.
Okay,
Yes.
and they lessen or they disappear also. But still, if they persist and really it is worrisome, then maybe cyclosporin will have to be changed something to another drug like
Hmm.
maybe tacrolimus or azathioprine or mycophenolate mofetil.
Right, right, right. And just the last query about dandruff and itching, which is so common after the transplant. So, and because of dandruff, generally we face hair fall, which is relatable. So in that case, what can be done?
Okay. See, dandruff is basically it is a it is a skin response to a fungal infection. Now, this fungus is a commensal. That means it resides in our skin, and on everybody's skin. Only when it gets a favorable condition, it will start growing, and then the skin starts forming more and getting shaded faster, which we see as flex. So it is a response to expel the fungus. Okay. So a lot of anti-dandruff shampoos are available, which will have mild to severe anti-dandruff agents. So these are basically to kill the fungus or control it, or control the growth. Okay. So that is why we always say that dandruff cannot be cured completely. It can be only controlled by shampoos. You will have to use some or the other shampoo. Maybe the cure lies in you. Um, Maybe it will go on its own. But if it is occurring, it is not because the drug is failing. It is because your body is reacting that way. So then you require some or the other antifungal agent in an anti-dandruff shampoo to control it. Okay. And it always builds every 3-4 days. So we keep telling patients to repeat it after every 3-4 days and restrict the anti-dandruff shampoo only to scalp usage, because dandruff is a skin condition, but it occurs in the hairy areas. So usually scalp, or nowadays so many males have been started keeping beard and mustache. So we commonly see even in beard mustache area, okay, or it can be rarely in pre-sternum area, or even underarms. So basically dandruff occurs where thick hair like scalp hair are present. So there is no complete cure. And when I say it is a fungal infection, it is not a contagious infection, because everyone will be having this fungus. So it is not contagious. It doesn't spread via foam through in salons, or it doesn't spread via by using any towel or anything. So it is not contagious like ringworm, which is a fungal infection. So many patients keep visiting different doctors, dermatologists, that वो ये shampoo use किया लेकिन गया ही नहीं. There is no treatment, guaranteed treatment which will make dandruff go permanently. There are triggering factors. So it is for some it is dry scalp, for some it is greasy scalp. So depending on that, we can use the products. Okay, if it is dry scalp, we sometimes tell patients to use hair oils. If it is greasy, then hair oils have to be avoided.
Okay. So another question is that can soap cause allergy, can cause dry skin because she's getting skin itching after a bath. Which soap should, in that case, should be used?
See, soaps, again, the skin pH is acidic, 5.5. Okay. Now, all the over-the-counter soaps are highly alkaline. So,
Hmm.
first thing for soaps, we tell to use pH balanced soap. And if it is dry skin, then moisturizing soaps. So, there is a word called syndet. We don't call this pH balanced soap even soap. It is syndet. Okay. So Dove is a good one because it has a neutral pH of 7. So, and it is universally available. Otherwise, there are not medicated, but pH balance soap. Sebamed has a good range, pH balance soap. All of the Sebamed products are available in the market.
I think we lost the connection with her. Do you have some more questions? We can post it on the chat box. So the name of the soap was Dove, and which has a pH of 7 and more. And another brand she mentioned was Sebamed. So Sebamed products for skin are very easily available at chemist shops, uh, and also good for skin because they have, as mentioned by ma'am, they have a good pH level. Uh, so we will take more questions. We will wait for her to join. Maybe I can summarize uh, whatever she has shared so far. She shared the role of supplements in our for hair growth. So the use of iron. It can be also the use of amino acids. She shared is really important for hair growth. Then there is also the use of selenimic, as mentioned by her, retinoids and flavonoids. So the role of supplements are really important, as she mentioned. So ma'am has joined. Ma'am, you can unmute yourself.
Hello, am I visible?
Yes,
Sorry for the technical issue.
no problem. We were revisiting what you shared already.
Okay. So soaps, we can always use pH balanced uh, moisturizing soap, and this can be used for everyday usage. Okay. And if at all you don't want to go like if you're not sure, because these soaps will be available only on the chemist store. So Dove is an excellent alternative to this. Yet, still, if the skin is very sensitive and dry, then we are advised to use non-soapy alternatives like cleansers. So Cetaphil has an excellent range for face and for body. So these are gentle cleansing lotions which cleanse as well as moisturize, like hydrate the skin. So these are very, very safe on the skin.
So there is this one academic question as well, that can stress results in the dryness of our skin?
Uh, Stress will not result in dryness, but it can trigger eczema. Dry,
Okay.
Dryness is something which is either it is genetic. It can be genetic if you have atopic nature, and it can be acquired also because of the climatic conditions, because change in lifestyle, because nowadays everyone is using AC throughout, and so AC usage also dries out your skin. So stress is not it can't cause dry skin, but dry skin and stress combination is definitely the person is at more risk to develop eczema.
But stress can also lead to breakdown of acne and ulcers, mouth ulcers. Is it?
Pardon?
Stress can also lead to mouth
Sorry,
ulcers
yes.
or Ma'am, are we audible? We lost her again. So, any more further questions anyone want to ask?
Okay.
Can so
Yeah, stress, what you were saying, stress can,
stress can also lead to mouth ulcers and
yes,
acne.
yes. It can lead to mouth ulceration, like what we call actus ulcers, okay? And even acne can exacerbate. Or nowadays, it is all the adults are facing stress-induced acne because stress causes hormonal imbalance, and then that can trigger your acne. So, stress-induced PCOS is becoming very common, like it is secondary PCOS. No one might have faced PCOS at the beginning, but it can be later in adult life. So, adult onset acne is also there, and that is definitely because of stress. And patients who never had acne in life, yeah, as a teenager, they get acne in adult life. This is becoming very common, this trend. Because when I started my practice, this trend was not there.
This is something new to understand and to
And
know.
like we used to tell patients, हाँ 25 हो गए तो चला जाएगा. But now, no, it will just continue.
Right. So
And
another
of course, steroid and many of the immunosuppressant drugs also cause acne. So steroid, cyclosporine, they also cause acne. The nature of the acne is also different with steroid and cyclosporine. Steroid will just cause red bumps, okay? Uh, Whereas cyclosporine steroid also can cause mild to moderate, but cyclosporine usually high dose cyclosporine can cause quite a severe acne. So, but as I said, that once the dosage is reduced, all this side effects start lessening or even disappear.
right.
Only during that period, some solution can be given to the patient by the dermatologist.
Right. So another question is, ma'am, that what are the blood tests we need to do in order to check if we have any nutritional deficiency when it comes to hair fall? And if we don't have thyroid issues and hemoglobin level is also in a range, and she is also taking Dexo range. So,
Okay. Then it is just because of really, you see, loss of hair of 50 to 100 um, is normal per day. Per day loss of 50 to 100 is considered normal. But still, for some, even 50 to 100 loss can be causing sparseness of the hair. So that also depends. In normal, there will be a loss of some hair. Also, there is something called seasonal shedding of the hair. So post-monsoon, always we see a lot of hair shedding. So if everything, all the there is no nutritional deficiency and the nutrition is quite good, then still the hair fall is there and it is causing sparseness of the hairline, then definitely the hair serums or minoxidil preparations can be tried. Otherwise, just you can restrict to good nutrition and some nutritional hair supplements.
and how about this?
My best advice will be to go for natural, like always drink lot of water, 8 glasses of water per day. Take a lot of seasonal fruits and vegetables. So your diet should be very colorful. And then whatever veg, non-veg, as your preferences, but go on a healthy way. So less of salt, less of sugar, and oil, less of oil. So a very normal um, homemade food is the best. And always go for seasonal fruits and vegetables. No need to have any exotic fruits from which come at any time from now. Fruits are quite imported from all the countries. But always go for seasonal fruits and vegetables. We have lot of fruits like ranging which have a lot of vitamin C. Fruits come in monsoon, come in winter. Berries come in berry, cherry, all this come in plums and peaches, all this come in monsoon, like even India produces. So whatever seasonal what we get, fresh fruits is always preferable rather than getting some exotic imported fruits. And vegetables, our country has beautiful range. Okay, so it is like because supplement already you are on multiple drugs. So do you want to take more supplements? Where they are only going to give you a nutritional enhancement. So it's better to always focus on your diet,
Right.
and that's it.
And how about the skin pigmentation? We face freckles and the small dark spots. So what can be done for that?
See, the use of sunscreen is a must because
Yes.
those who have a tendency to freckle, they will keep having it more. And also, because you are on immunosuppression, you at some in later age, it should not from a freckle, you should not get any skin cancerous change. Okay. So, still, if they are cosmetically disfiguring, then we can have a range of creams available, certain spot chemical peeling treatments, or again, I told you, if they're very small, then chemical peeling and laser treatment can be done. But again, with use, whether if the patient is going to use the sunscreen before and after, so that care is also very important. And what type of skin it is? Is it very thinned out skin because of steroid? Then probably we will not go for that treatment.
Hmm. Right. So I was about to ask this question that how safe peeling and skin, this treatment, which are very trending these days, and every other person is going for it. So can transplant recipient think about it if they want to?
Only after evaluation from a good doctor.
Okay. And it depends from skin to skin.
Yeah, it depends upon skin to skin.
Right.
And some patients really they they use all this sunscreens and moisturizers on a strictly on a daily basis. They take a lot of care. So maybe these patients can be thought of, and it depends upon the skin type. If already it is thinned out, easily bruising, then laser is just a contraindication. Majorly maybe we might not think, but again, then looking at the skin type and really how much involvement of the skin is there. If only few spots are there and patient really wants the treatment, then that time the decision can be taken. But there is no generalized thing that all this all these treatments are safe and can be given to the transplant patients. That I would not suggest. So it's better to be, the skin has to be evaluated by the dermatologist. Maybe for certain treatments, we will only say no, that this is not for you because
Hmm.
our expectations have to be realistic and safe.
Right. Yes, I agree to that. So one more last question is that can we use soaps on our face? Is it safe?
Soaps, if you're using what I said, Syndet, so pH balance moisturizing soap is fine. Otherwise, a cleanser is a good option, especially for sensitive skin. Cleansing lotion will be a good option. Again, cleansing lotions don't have a perfume. If you're using from our pharma companies, cleansing lotion never has a perfume. So these are very safe. These are non-soapy alternatives and non-fragrant. And usually there are no parabens also in this. So these are quite safe.
Hmm. Right. And like you have mentioned earlier, the treatment for eczema. So someone might have missed it. So they want to know what was that you mentioned before.
So you want to repeat treatment of eczema? Okay. See, eczema is a very itchy condition. There are different types of eczema. So sometimes it might be just dry skin, and it is seen. It is not. It is cosmetically disfiguring that dry skin patches have come. And that in that cases we only give moisturizers. Okay, but if a proper eczema is developed, like and it is quite itchy and uh, uh, discomfortable, then we prescribe oral medication like anti-allergic medications. And of course, there are certain safer, like depending upon what is your health status, we will be catering liver safe or kidney safe. That way, we can give you oral medication to control your itching. Then a good moisturizer can be suggested. And of course, if the eczema is quite severe, then to have a control in the initial phase, some steroid application will be given. Now, again, when I say steroid, steroids have different potencies. So it can be mild, moderate, and even a higher potency. So depending upon the eczema type, we start prescribing the cream. Again, once the eczema is controlled, we have to evaluate and either change the steroid or stop the steroid. Okay. If you continue using the steroid cream, you might develop some side effects because of steroids. And also there is something that you will not benefit from the steroid. You will get used to that steroid. So there will be no benefits, but you might land up in some side effects. So that thing is because once the patient get prescription, they keep using it for a long time. So it's always, I sometimes write a prescribed steroid and tell patients how long to be used, and I write there STOP, stop. So when I know it is not to be used, I usually write this in my prescriptions. And then again, the steroid can be the effect of the steroid can be maintained further by giving tacrolimus, because tacrolimus is a steroid sparing agent for skin. So then tacrolimus is for maintenance phase. For acute control, we always try to use steroids. Okay. And if everything is under control, then we keep emphasizing on the use of moisturizer. And still, if a relapse comes, then of course, again, the medication is started, depending upon the type of the eczema.
Right. So it was an eye-opening session for all of us, I believe, and taking back a lot of points. And first, very important point for me is to to have any skin issues. First, we need to definitely go and visit a dermatologist and see dermatologist as soon as possible. So thank you so very much, Dr. Sandhya, for having an enlightening session for all of us. It was really a lot of point takeaways for all of us. Thank you so very much.
Yeah, it was good for me also to interact with you, everyone. And I hope you have you have learned something out of this, and you will take care of your skin and hair.
Thank you so very much. Thank you. Thank you everyone for joining. And if you
Bye-bye.
have more queries, you can put it in the group or we can reach out to ma'am as well. Thank you so very much.